Black Health Now, your weekly check-in on how your family can get and stay healthy. Joined by experts from around the world, here are Dr. Mike Lenore and Ellis Dean.
Good evening and welcome to Black Health Now, a new style program here on blackdoctor.org in partnership with the African American Wellness Project. Welcome back. We are happy to be back. We are happy to be with you this evening to give you all the health news that you can use. So tonight we have a jam-packed show, so let's talk about it. We're going to be talking about monkeypox, okay? What is the name about and why are they now changing it? What are your concerns and how can you protect you and your family? COVID is coming back. We've got to make sure how to keep your family safe. We're going to be talking about abortion. What can we do about it? And what are the health implications for you and your family? Plus, we've got a couple of fun shows, fun articles, and fun events that we want to talk about. What are the health risks of going to the nail salon? And finally, something for you ladies, irritable male syndrome. Does your man have it? And how can we get over it? That plus more here on Black Health Now. Well, we cannot get this show started without bringing in the main man, the man of the hour, the day, the year, the decade, and the century, also known as Dr. Michael Lenore. Good evening, Dr. Lenore.
Well, that's probably the greatest introduction I've ever had. It gives me a status that I've never known that I've had, but I'm glad to be back. I'm glad because a lot of things happen every week that Black folks need to know about and other people need to know about as well, so they can deal with some of the issues that we deal with all the time. Lots of news all the time on what's happening in the Black community. Too often we don't get it until we don't get the news until it's just too late. So that's what Black Health Now is about. So every week we'll be here trying to bring you the latest information that we can find and some subjects that if you want to discuss, let us know, and we'll bring those into our program. So let's start off, man. Let's start off with my favorite, which is the monkeypox. Let me ask you a question. Where has it been all this time? I mean, obviously it's been traveling across some continent. What happened to make it a situation here?
Well, as far as I can ascertain, it's always been around. It's just been it's a cousin of smallpox, which of course, as you know, it's something that was dangerous, many eons ago. But it's always been around in a kind of course in underdeveloped nations, and then some sort of resurgence happened in Europe. And now it is, as you know, we live in a world connected world. And it is now spread here to the United States, and we're getting cases. It spreads rather easily. It's not an airborne, but it spreads through contact. Mostly here in the United States has been intimate contact that has been the most, most of the issues have come from intimate contact for men having sex with men here in the U.S. And then I just read recently that, of course, when an illness happens, it impacts Black and brown communities at a higher rate. And so Black and brown men who have sex with men are seeing a higher and disproportionate level of monkeypox.
They really are trying to, and probably more accurately, make it not a disease of gay men. I mean, that it's a disease that children can get and other people can get. And they want to change the name. They don't like monkeypox. They want it to be MKP. So when you hear MKP, it used to be the old monkeypox, but I think it's not cool. It's not cool to get monkeypox. But one good thing about it, it's relatively harmless in terms of long-term effects. It gives you a rash and you're pretty miserable for about a week. Then it disappears and there's no residual, and the vaccine's 100% effective. So I think we'll keep our eye on that one and make sure it doesn't do multiple.
There is one notable exception, though. If children get it, it can and has proven to be deadly in children. So we have to make sure that we're protecting our children. And there have been some vaccine shortages. And so they've been rationing out the vaccine while they're trying to produce more of the vaccine. And because they've been rationing it out, it hasn't been as effective because they're not giving the normal doses as they're trying to spread out the vaccine. So just, make sure that your kids are protected. It's through contact. We know where it is, but we don't want to stigmatize this disease, you're right, because it is a disease that's spread by contact and not just, it's not a sexually transmitted per se.
Yeah, a little bit of an opinion here. Every day, 10 people die from asthma. Many more people die from heart attacks.
Right.
Every single news program I see deals with monkeypox, and I'm not seeing asthma or heart disease discussed in a very long time, but we will discuss it. Since we've been off the air for a couple of months, lots happened in the COVID arena. Clearly, it's not going away.
Nope.
It's certainly still a very dangerous problem for a lot of people. I think we've made the decision in this country that we're going to accept 400 to 500 people dying every day, and 1,300 children to 1,400 children have died in order for us to have a normal lifestyle. I guess that's the natural evolution of a situation like this. What say you about that?
I think it's irresponsible, and I think it is a byproduct of kind of a modern society. And what I mean by that is that we see death, even though it is faked on TV all the time. We see fake deaths on our video games. And so therefore we can't quantify it. We have been taught to devalue life. And so doing many things through racism, life has been devalued through movies and video games and television programs and all these graphic things that we ingest into our subconscious consciousness every single day, that those deaths that you're talking about don't register. That's just a number, but they don't realize that there's people and families that are impacted by this, and that we need to do something to protect those people and those families. We just don't feel it.
And, no question, still a lot of unvaccinated people. And we'll talk a little bit later about some of the theories on hesitancy. But before we do that, a lot of things are about to happen in the next several months. The Omicron 5 variant is the one that's the big one in the game right now.
Yep.
And Dr. Noah Abalata from the Roos Community Clinic is going to update us on what's happening now and what's about to happen with the COVID and the new COVID vaccines.
Yeah, well, we have a couple of exciting things going on, I think, with COVID and vaccines. One is that Novavax is now available. So for people who really were not comfortable with the newer technology, the mRNA technology, the Novavax is a protein subunit vaccine. So it's like some of our flu vaccines. So some folks have actually been waiting for this. They've been waiting for something that wasn't the mRNA for whatever their individual reasons might be. And so now that is available. So we're really wanting to get the word out about that. And so maybe folks who might have hesitated on the mRNA may want to take up the Novavax. And then the other piece of news is that in the fall, we're anticipating the bivalent vaccine, which some people are just calling like the Omicron booster, which is basically a little more tuned towards the variants. And so that will be forthcoming. And I think we'll just need to see what the supply looks like, what the recommendations are going to look like. Is it going to be a certain age groups, or is it going to be for everyone? And so I think some of that still remains to be seen.
Some of the interesting questions are, if you haven't been vaccinated, do you just go get this one? Or do you have to go through the whole process of catching up to get to this one so that it's more effective?
So this one is going to have the old variety and the new variety in it. And so you won't need to get the old ones. But I think that it still is a question. If you haven't gotten any yet, would you get 3 of these? And I think that's probably what it's going to be. You're going to still need a 3-dose series, but it would be with this newer version, because this newer version is it's going to be more updated to the variants that are circulating now. And hopefully we won't be behind. Hopefully when the winter surge comes, we wouldn't have yet another variant and need yet another vaccine. But I mean, the fact is we don't know yet, because last year, we weren't expecting the Omicron surge to happen, around Thanksgiving, but that's what happened.
Yeah, well, I think that here again, there's a lot of unknowns in these vaccines. I mean, I tend to get the vaccine early, so I assume that much of my immunity toward COVID was waning until I got COVID, which gives me another 90-day window. I think we're still looking at the difficulty in getting people to get that 3rd booster, And we're looking at the impossible task of trying to get children vaccinated.
Okay.
So good discussion. I mean, obviously, this poses a dilemma for people who are unvaccinated or partially vaccinated and don't know whether they want to catch up or whether they're going to continue in the particular position they're in.
Here's some crazy thing. Here's one thing that I found to be extremely strange. Novak Djokovic, who is one of the top tennis players in the world, just withdrew from the U.S. Open because he is unvaccinated. We have vaccine rules to be able to enter the United States from another country. There's vaccine in New York. They have vaccine rules, and he's choosing to withdraw from the tournament instead of getting vaccinated. That's how hard a stance people that are against the anti-vaxxers are, that they're going to really kind of hurt their own career because they don't want to get vaccinated. It doesn't make any sense to me.
I read an article yesterday. I want to make sure people know we're keeping up to date. But yesterday, an article on hesitancy, where the first article I've seen when it's really been studied. And it looked at a number of dynamics that cause hesitancy. The first thing is that people just don't trust the government or the people that are telling them to get the shot. They just don't trust them. And when you don't trust somebody, you're less likely to do any of the things that they tell you to do. I think the other piece of that is in many countries, like in Hong Kong, for instance, there was a lot of hesitancy to begin with. But when people started to understand it affected the whole community, then they were more likely to get vaccinated. Well, here our communities seem to have completely broken down. Even within the Black community, we don't see community like we used to see it when I was growing up. Now, that was a long time ago, but I do think that it's within recent memory. And we don't have the kind of communities that we used to have where one person felt responsibility for the other. Another one of the rationales for not getting vaccinated is because you want to be part of the resistance. You don't know what you're resisting to, but you want to be a kind of a patriot, kind of a rebel, and that's another rationale for people not getting vaccinated. Lack of trust, and the fact that when we don't see it ourselves as a community like many countries do and many neighborhoods have, and finally, because a lot of people just rebelling against everything. This is just another thing to rebel against. One thing that they did say that was consistent was that in order for us to change this dynamic, especially when we're talking about children, is you have to be empathetic to the person who has a different opinion. And without empathy, nothing changes. And so consequently, I think there's going to be some decisions that need to be made by parents and families about how they're going to deal with it, because the further out you get from the necessary vaccines, the more difficult it is going to be for you to protect yourself if some more serious variants come along.
It's tough. I think this kind of individualism that's part of the American DNA is not going to go anywhere. It's not going to change. And individualism means you are competing for everything. You're competing for resources. You're competing for jobs. You're competing for food. Everything is a competition. And when you're competing, when you don't see your neighbor in a neighborly fashion, you see them as competition, then we're never going to get to that community feeling that you're referring to. Now, what you also want is the time when you grew up is that there was an us versus them mentality in the Black community. Us being Black community versus them, the white establishment. And so, but once segregation, the walls of segregation was taken down, the integration started happening, and we started living and feeling like, oh, we can be just like them. We lost our sense of community. Those of us that had a little success, some of us looked and said, oh, hey, we don't have that sense of connection to the community. And we started adopting that individual competitive attitude when it comes to each other and when it comes to our neighbors, just like everybody else. And so that's a bigger wall to climb to try to find a sense of community in a country that never really had it.
I hope we don't have to wait for that asteroid. The asteroid threatening the whole world. Everybody comes together. But you're right. We need to really kind of call back on that sense of community to move forward. Yeah. You're listening to Black Health. You're looking at Black Health now and listening on our podcast. We want you to stay with us. We're going to take a short break, and when we come back, we're going to talk about how the new Roe versus Wade decision affects not only African Americans, but young people. If you've tested positive for COVID-19 and have a common risk factor for serious disease, there are several treatments that can help you. Paxlovid is a 5-day course of pills that leads the list of recommended treatment. In unvaccinated people at risk for serious disease, Paxlovid was 90% effective in cutting the risk of hospitalization and dying from COVID. The drug is cheap, but hard to get. You need a prescription from a doctor. So contact yours, visit a Test to Treat site, or try online urgent care. But be prepared to test quickly, know your risk factors, make sure insurance covers it, and find a pharmacy that stocks the drug. Always remember it's important to get vaccinated and get boosted. This health tip is sponsored by the African American Wellness Project.
Okay.
All right, welcome back to Black Health Now. Obviously, it was a real big turn to the head when the Supreme Court, those very same judges who said they didn't like settled precedent, overturned Roe versus Wade. And now there's chaos throughout this whole country. Lots of states have put in almost draconian laws to try and prevent abortion. It looks like almost if you think about an abortion, you can be arrested in some states. We're going to talk with Dr. Mays. She is a adolescent medicine specialist in Oakland, California. We're going to talk about the impact of Roe versus Wade on her personally and certainly on the young people, adolescents that she treats, a group that's often forgotten. Let's move into abortion. You said it very nicely, and a very wonderful article is written about you and the services you provide. And when you said that, you were kind of shocked. You'd been struggling and marching and doing stuff, and all of a sudden you look up and everything has changed. I go back to the era of pre-abortion. That's how, I guess that dates me, but how can I hide? Event, and when back alley abortions were the rule rather than the exception. I was an intern at Los Angeles County, taking care of 40 patients with endometritis. And so consequently, I remember that era because people will get abortions.
That's right.
What say you about what's happened?
Yes, I felt a little embarrassed that I was so shocked, but I really was, and I've been working around reproductive rights and reproductive justice for young people my entire career. And I never thought this would happen. And we've been talking about that this could happen. And so I think it just is a reminder that we really have to stay vigilant when we talk about reproductive freedom and reproductive rights, because it's abortion today, but it could be contraception tomorrow. It can also be access to other types of family planning services a month from now. So I that was something that just really floored me. And when I think about abortion services for young people, we are fortunate in the state of California where we have a government and a governor that is supporting reproductive freedom and reproductive rights for all people, including adolescents. But there are so many states across the country that where so many women and young women will be affected. The numbers we're talking about are like 30 million women including young women, will have staunchly restricted abortion access because of this federal legislature, which is why it's so important to have the federal protections for abortion. The other thing I think about is working with Black and Brown young people. So again, here in Oakland, I work with Black and Brown youth every day, and those are the most marginalized youth in the community. Those are the most marginalized youth in the nation. And when we think about the epicenter of where Black youth live, 50% of Black youth live in the South. Those same Southern states are the states that will be disproportionately impacted by abortion restrictions. So this is an issue that directly impacts Black youth.
And I'm just concerned that we need to get engaged in this, and that African American women may need to take the lead in this.
That's right. This is beyond abortion. This is a civil rights issue. This is a reproductive freedom issue. So when people ask me about abortion in young people, they're like, "Oh, so you only are thinking about when young people get pregnant that they should have an abortion?" I said, absolutely not. I think that young people should have choice. I am 100% supportive of young people who also choose to parent. So I am support of young people exercising their reproductive freedom, which includes the right to have children, the right not to have children, and the right to parent their children in safe and healthy communities, which are the reproductive justice principles, which were started by Black women in 1994. And so again, yes, this is a political issue. This is a Black women's health issue. We know that Black women, we already see the impacts of the disparities around the mortality rate for Black women and Black babies, irrespective of socioeconomic status. And then when we look at the health status in the states that have the highest numbers of Black people, those also have the lowest health. Those have
outcomes.
Yes, health. Yes, those also have the lowest health outcomes. And so again, this is hand in hand. And so again, this is the long haul. This is the long fight. And if we care about the health of Black people, of Black families, of Black women, then we have to be in and care about the abortion and abortion freedom.
Well, thank you, Dr. Mays. It's a really interesting perspective. We don't often think about what's going to happen to our young people with these new draconian laws. And the other thing is always that bothers me, Mr. Dean, is that they don't mind you having a baby, but they don't care nothing about it when the baby's born. And the safety nets in many of these very same states are terrible. So let's turn it over to some of the things that you want to talk about. You kind of concern me, because I don't go get my nails done, although maybe I should, but obviously you've got some concerns.
Well, as we talked about at the top of the show, there are some concerns about when you go to your nail salon, right? And so there are some serious health concerns. And so, and we're talking about this. People go to the nail salon all the time. I go every once in a while. I do get my feet done every once in a while, so I'm not afraid to say it. I get a pedicure from time to time, not as much as my wife and other people do, but I get one done from time to time. And so when I found this article on Black Doctor, I was like, oh, we got to tell our people about this, because I don't know if they saw this. So there are 5 different health concerns that can happen when you go to the nail salon. So the first one is nail fungus, right? So nail fungus can happen when you're putting in the water. If they're not cleaning that pedicure where you bath, where you put your feet down in there, if they're not cleaning it properly, you can get some fungus on your feet and in your nails. The good news is there are some creams and drops and things like that that can help you get rid of that fungus. So just make sure that if you're not comfortable with the cleanliness of that where you put your feet in for the pedicure, that you ask them to go ahead and clean and disinfect it. Particularly now we've got monkeypox or MKP, as we talked about earlier, out there. Number 2, warts, like literally like warts. Like you would think like a frog, you could, you can get warts. Warts are caused by HPV. Now that is something that you've heard about. There is a vaccine for HPV that you can give to teenagers that's out there, that's available. Warts are caused by HPV. They also can be treated, but again, make sure everything is cleaned if there's an issue. UV ray exposure, right? So UV rays are those rays that are attributed to damage to the eyes. That same light that they use to kind of rapidly dry your nails when you put them underneath, or you put your feet underneath the thing, that is UV rays. And those are the same rays that they use in sun tanning and tanning beds and tanning salons that have caused skin cancer and other related conditions. And so over time, because you're probably going to the nail salon more than you're going to the tanning salon. And I know some of y'all, we're on Black Doctor, y'all not going to the tanning salon, but you're getting more exposure because you visit the nail salon more than people visit the tanning salon. So you just have to be careful with regards to that UV exposure. The fourth one is respiratory irritation. And we all know that smell when you walk into the nail salon. It's like, it's what it is. You get used to it. But there is a combination of odors and some of the chemicals that they're using in the nail salon that can irritate your respiratory, especially if you have asthma, it could irritate that and cause an attack. So you have to be very, very careful about the respiratory disturbance. And finally, and one of the most serious ones is MRSA. That is known as methicillin-resistant Staphylococcus aureus, MRSA. And that is the symptoms of MRSA are swelling, redness, cracked skin, and some pus. And some of the maximum consequences of MRSA could be scarring, amputations, and even death if it gets too much into the body. So those are some of the things, 5 conditions that can happen just by going to get your nails done.
Yeah, well, none of this is going to stop my wife from getting her nails done every week, every other weekend, or every month. I'm not sure what the frequency is. But as an allergist, I can tell you, I have a very large contingent of beauticians because of they're working around these chemicals. And these chemicals cause respiratory issues and skin problems. So it's not an insignificant problem. I think most of the reputable nail salons have pretty good ventilation systems and try to take advantage of the information that you're giving to other people. But I do think that when you pick a nail salon, you should be concerned about some of the things that we're talking about. And if you see things that don't seem right, in terms of hygiene or in terms of chemical smells or in terms of any of that, say something, because these are real problems. And I see them. I see the other end. I see the people who are actually working with these situations on a daily basis. So.
A quick tip is that you want them to sort of like that pumice stone that they use to rub your feet and things like that. You want to watch them bring out a new one and open a new package for you, right? And so, like, yes, you're probably going to pay more because they're going to have to keep, but when you start seeing them reuse instruments over and over again on multiple people, that's when you should have your highest rate of concern, because now those germs could be shared and spread amongst multiple people. So they need to have that little film that they put into that they pour the water into, so you're not putting your feet into the same tub. They should remove that and throw it away. So all those things, yes, that increases the cost for the nail salon, and they're going to pass those costs on to you. But I'm like this: be safe rather than sorry later on.
Yeah, I would get a pedicure, but that would require a salvage operation. You got another interesting condition that you brought up this week in our pre-news meeting.
So this was an interesting article, and
I'm stepping away,
you got to slide back on this one. So, ladies, I want you to lean close on this one, because this is one specific for you. So think about your mate, think about your husband, boyfriend, whatever. And there is a condition called Irritable Male Syndrome. And what this is it's a condition because, and most often the time, in a misogynistic society that we live in, we tend to associate a woman's menstrual cycle with mood swings, right? But because men don't menstruate, it's like, oh, we're just so even keeled. No. What happens with irritable male syndrome is our mood swings are coinciding with our rise and fall of testosterone. Our testosterone is higher in the morning. And so therefore, and many things come with that, but throughout the day, it has ebbs and flows. And it flows with our mood swings. So when things are not going well for us, our testosterone drops. We tend to get a little bit more moody, a little bit more irritable, and you should notice that. Some of the other symptoms of irritable male syndrome are irritability, as we talked about, being distant or overly sensitive. So I can speak to some of that. Because testosterone is like that radio equalizer. So it keeps us even keel, but when those levels drop, and as we get older, our testosterone starts to drop over time. I think it's about 1% each year as we age, after the age of like 20 or 30. So how do we keep our testosterone levels up? Well, with a healthy diet, we hear that again, healthy diet, regular exercise, will help increase the testosterone levels and reduce the possibility of irritable male syndrome. Also, if you're not doing enough on that, then you can go to counseling and help your mood regulation, get at that, and then that will help the testosterone levels balance out so we don't have those mood swings and be called an irritable male.
So I'm glad you brought that up, because I've been accused of being a cranky old man. But now what I'm going to do is I'm going to say, hey, and don't bother me right now. I'm having an irritable male syndrome moment. But I think that there may be something to that.
Well, I just think it's a good way for, especially women, if you're married or if you're dating someone and you're beyond the age of, specifically like in your 40s, you notice that sometimes your spouse or significant other is moody, and you're like, well, I didn't do anything. Don't take it personally. It could just be a testosterone swing they're going through in the moment. Try to be supportive when you can. The same thing that you would want him to do for you when you're not feeling well, you're not feeling your best, when you're kind of emotional. Same thing you would want him to do for you, you need to do for him. Now we have a real kind of condition to label it versus just saying he's being a a-hole.
Well, but one good thing about this discussion is that it's a good indication that most men should know their testosterone levels.
Yes.
Because a lot of times they're low, and you don't know why they're low, and they are. There's no question that low testosterone can change your mood, and so consequently, it's like vitamins. You should know your testosterone levels.
Know your levels, but also know that as you get older, doesn't testosterone contribute to prostate cancer? So you can take a supplement of testosterone, but just be very careful and keep those levels in a normal range and not too much.
Yeah, well, it looks like we've spent most of our time for this week's edition of Black Health Now. Every week we're going to be here. If you got some suggestions about what you'd like to hear, let us know. You can email us at the AA Wellness Project or blackdoctor.org. Email me personally at Dr. Lenore at drlenore.org. Anything you give to us in terms of suggestion will help make our program better. But we did think that it's really important for you, for those of us who are Black Americans, African Americans, however you perceive to call yourself, that you keep up with the latest information and the latest news, and that's what we're all about. So I guess we should finish it the same way we always do.
Always.
Health is your biggest asset, so protect it. Talk to you next week.